Some doctors say they're worried about the number of ads for Ozempic recently appearing everywhere, from sporting events to public transit across Canada. Ozempic is approved in Canada to treat type 2 diabetes, but it is sometimes prescribed off-label to treat obesity as well. The marketing campaign comes on the heels of an unofficial Ozempic promotion for weight loss by social media influencers and celebrities. Vancouver endocrinologist Dr. Ehud Ur says the aggressive advertising campaign could further drive people looking for cosmetic weight loss to pressure their doctors to prescribe them Ozempic. Dr. Ur says that the benefits often aren't worth the risks for people that don't have diabetes or obesity. Ozempic manufacturer Novo Nordisk says its marketing campaign is aimed at helping people with diabetes get the treatment that they need. Well, joining us now to give us more insight into this drug and the risks and benefits associated with it in our weekly medical segment is Dr. Abhishek Raut, medical director at Appletree Medical Group. Dr. Raut, welcome back to Forum Daily.
Great to be here, Nima.
So what do we know so far about Ozempic and its sister drug Rybelsus? How is it intended to be used and its efficacy?
Right. So now both drugs are approved in Canada for the treatment of type 2 diabetes specifically. Ozempic is an injectable medication belonging to the class of GLP-1 receptor. So basically, it stimulates the release of insulin and it slows down emptying of the stomach. Rybelsus, on the other hand, very similar, but it's the oral equivalent there of the GLP-1 receptor. Now, both drugs are really intended to be done in conjunction with diet and exercise, and both drugs have had some good effectiveness when it comes to lowering our blood sugars, and in certain cases, promoting weight loss as well.
All right, Dr. Raut. Now, Novo Nordisk says its marketing campaign is aimed at treating diabetes, but this drug is also said to be prescribed off-label to treat obesity, as you highlighted. So how does this work, and what does prescribed off-label mean?
Right. So prescribing a medication off-label, it really means using a drug for a purpose that is not specifically approved by any regulatory authorities, the FDA or Health Canada. So in the case of Ozempic, even though it is approved for treating diabetes, we know we have certain healthcare providers who do prescribe it off-label, in this case, for weight loss there.
All right, Dr. Raut. Now, there are social media campaigns promoting weight loss using this drug. What are some of the broader implications of this sort of unofficial advertising to consider?
Yeah, I think it's definitely a new world out there. What we're seeing with these social media campaign is it's definitely creating a lot of demand for the medication, but that's a problem as well because it then leads to shortages and limited availability for people who actually need the medication for diabetes management. And of course, the broader issue here is relying on social media campaigns for medical advice can also be very risky because it tends to sensationalize the positive aspects, but not really talk about the negative aspects of a medication.
And I want to go back to Dr. Ur's warning that the risks for people who don't have diabetes or obesity aren't worth the benefits of using this drug. So can you tell us a little bit more about these risks?
I think Dr. Ur raises a few valid concerns for sure. So Ozempic, for instance, it can be effective in managing blood sugar levels, and it has that weight loss implication, but it doesn't have zero risks. We have some common side effects like nausea, vomiting, diarrhea, but the ones that we really get concerned about are things like pancreatitis or thyroid tumors or even gallstones. So therefore, when we're looking at people without diabetes who are then exposed to those risks, you really have to have a good assessment of whether those risks outweigh those benefits or not. And oftentimes they do not.
And doctors, including Dr. Ur, are expressing a lot of concern on this about this aggressive marketing campaign around Ozempic. So what is your stance when it comes to this marketing campaign?
Well, look, I think in any marketing campaign, you need to really have a balanced and responsible approach to medications. So aggressive marketing campaigns should really be critically evaluated to see what their impact is on patient care. And really what we should see is prioritization of accurate information and really evidence-based claims while really promoting patient safety.
All right, Dr. Just about a minute left here, but as you highlighted earlier, this is an evolving digital world, and it's really easy for people, especially younger generations, to be influenced online. So what is your advice for those who may consider pharmaceuticals that are maybe consistently promoted online everywhere you look by even influencers and celebrities that you trust?
Right. So, as I mentioned, there's always this sensationalization aspect for medications. But, there's this old adage that there is a pill for every ill. but there's also an ill for every pill. And that's the idea that we see now, where we're seeing pharmaceutical promotions being really prevalent. It's really essential for individuals, especially younger generations, to really look at that information critically. So my advice would be to really exercise caution on what we're seeing online, especially with influencers, and instead look for information from very reputable sources like healthcare professionals and peer-reviewed studies.
All right, Dr. Raut, another helpful interview. Thank you again for your time today.
Thanks so much for having me.
All right, stay with us. We've got to go to break now, but we'll be right back shortly.